State of Affairs is pleased to welcome Dr. Ben Evans, president of the New Jersey State Nurses Association. Good to see you, Ben.
Good to see you, Steve.
Nursing profession is changing every day in so many interesting ways. Biggest change you've seen in the last 5 years is?
A move towards quality and a greater push for staffing accountability, I think.
What does that mean?
Well, patient safety and patient outcomes are driven by how we staff in healthcare settings. And so there's a push to make sure that we have enough qualified staff taking care of the patients to ensure quality outcomes.
So interesting. We've talked about this before. To disclose, the Nurses Association is one of the underwriters of our programming here at the Caucus Educational Corporation. But one of the things I've learned in some of our past programs is that a nurse is not a nurse, meaning it's not just every category. So I want you to help us on this.
Okay.
A registered nurse versus an advanced practice nurse.
Registered nurse has basic generalist education across a broad scope of discipline. They're licensed by the state of New Jersey, and they direct the nursing care of patients. An advanced practice nurse is someone who is prepared at the master's or doctoral level in a specialty area of care, and they can prescribe and manage healthcare conditions for individuals.
So as we talked to Ben, we're going into the summer of 2017. We don't know what's going to happen in Washington regarding the Affordable Care Act, the Trump administration, Republican Congress talking about. We don't know. But the Affordable Care Act did do very specific things, Dr. Evans. Excuse my voice. Good thing doctors and nurses are in the House. So they did many things as it relates to the role of nurses. Did it expect more from nurses?
I believe since 2010, when the Institute of Medicine put out its landmark publication, The Future of Nursing, it called for nurses to practice to the full extent of their education. There's been some changes in movement in that. The VA has recently expanded the role of APNs within their
the Veterans Administration?
Veterans Administration, yes, has expanded their role. 17 states have done away with collaborative agreements. So we're moving.
Whoa, what does that mean?
Well, collaborative agreement is an agreement between a nurse and a physician that allows the nurse to prescribe. It is not a supervisory agreement. It is simply a collaborative agreement where a nurse can contact a physician in their specialty who has agreed to work with them and give them some guidance if needed.
So what's happening with that?
In New Jersey, we have the collaborative agreement going on. 17 other states have gotten rid of that. It's sort of a hindrance to access to care.
So interesting as we talk about this. We're doing this in the context of a significant race for governor in the state of New Jersey. There will be a new governor in January of 2018 that follows up after Chris Christie. How much does it matter, Ben, who the governor is and what he or she thinks of and what their policies are regarding the nursing profession?
Well, we have a lot of folks who make regulations around nursing profession without ever consulting nurses. They're
How dare they?
Yes, right?
Legislators and others.
Right. And they come from business, they come from law, but they do not come from the discipline of nursing, very few. We have a couple in the state who are registered nurses, advanced practice nurses.
By the way, we've had here Nancy Munoz, a registered nurse who is a member of the state legislature, I believe, from Union County. Is there another one? I think there is.
There is. I believe there are two others.
It doesn't matter who they are. By the way, we'll check it out. Look on our website. We'll tell you who they are. Why is that problematic if you have non-nurses making policy regarding nurses?
Well, we know what the care needs and care requirements are for our patients. If someone is working on a staffing ratio versus a staffing acuity mix, you could throw bodies at bodies. That doesn't mean you're going to have quality care. 2 new graduates taking care of 10 acute patients is not the same level of expertise and quality as perhaps 1 seasoned nurse with many years' experience and 1 new graduate taking care of those same set of patients. And so you have a mentoring type relationship, a little bit of experience to fall back on. So nurses have a feel for patient care needs, they have a feel for what nursing workload is like, and it's very important that we be at the table to express what it is that our profession does and needs.
Ben, let's move from New Jersey to Washington. We are not going to debate or discuss in detail what is potentially going to happen in Washington, but how much does it matter what the president and the Republican Congress, Republican-led Congress, I should say that, what they do or don't do as it relates to the Affordable Care Act vis-a-vis the nursing profession? Can they impact it directly?
Absolutely.
How?
You can take away funding for programs, which then limit staffing. You can take away equipment or program funding, and
The federal government can do that.
you can limit DME, durable medical equipment, prescribers. For a while, nurses could not prescribe durable medical equipment. That's an access to care issue. So now we impact the consumer or the patient themselves. There are restrictions, and as we're not at the table, those things are missed.
That concerns you.
It does.
What impact do you think it could have on patients? I mean, this program is for patients, consumers, viewers of public broadcasting, FiOS, other places who watch us. Your patients, your prospective patients, your families are patients. What could it mean to patients?
Well, it could mean that anyone that walks into your room is considered a nurse, which is not true. If you have not been to nursing school, you are not a nurse if you're not licensed as such. And so you could be in an agency or a facility that is staffing with non-nurses to provide nursing care.
How would the consumer know that?
They would have to ask. And if the person illegally identifies themselves or just says, I'm the nurse, well, there's no protection for that.
Ben, go back on something. Does that person who walks into the hospital room or any room where clinical medical care is taking place, does that person have a legal responsibility to announce who they are?
You should always introduce yourself and what your role is, but that doesn't mean that that's always done.
More and more, with our physician shortage, particularly as it relates to primary care physicians, is it fair to say, Dr. Evans, that more and more is expected of nursing and nurses than ever before?
I think that the area of growth for that is in the advanced practice area. Advanced practice nurses look at, they are certified in a specific area.
Right.
There are adult gero nurse practitioners, family nurse practitioners, women's health nurse practitioners. These individuals who are trained and board certified at the advanced level are then filling in some of the areas where we're seeing shortages of physicians, especially in the family practice area.
And some of them are going for their PhD.
Yes.
And why would that matter?
Well, doctoral education is the top rung of any form of education.
A doctorate in nursing.
A doctorate in nursing. So you could have a PhD in nursing, or you can have an EDD, which is an education doctorate in nursing, or we have the Doctor of Nursing Practice, which is a practice doctorate, and it focuses on leadership, change, and quality for nurses at the advanced level.
And we need more and more professors of nursing
Absolutely.
in nursing schools, right?
Absolutely. The graying of the faculty is a real concern, and so we are looking at recruiting in to get more faculty.
And you've not that you're part of the graying, but you've been teaching for a couple of years in
I'm
nursing?
36, I think.
Okay, listen, I get so caught up in my conversation with Ben. Ben Evans, who is the president of the New Jersey State Nurses Association. That's it for this particular edition of State of Affairs. Let's continue the conversation. I will get this out. Follow me on Twitter. You see it? It's at Steve Adubato. We'll see you next week.
State of Affairs with Steve Adubato is a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. State of Affairs with Steve Adubato is brought to you from the Agnes Veris NJTV studio at 2 Gateway. Funding has been provided by Johnson & Johnson, Wells Fargo, Holy Name Medical Center in Teaneck, New Jersey, PSE&G, Bergen Community College, New Jersey Council of County Colleges, and by MD Advantage Insurance Company of New Jersey. Promotional support provided by the New Jersey Business and Industry Association and by NJ Advance Media.